Hi, this is Kristen. I'm Dr. Michael Schwartz, and we are doing a few things today. Kristen thinks she looks tired, and that, I believe, is mostly her lower lids. And interestingly, follow this Q-tip. We'll start with this and just look up. When you look up, it forces the fat in the lower lids out. She doesn't really have a lot of fat in her lower lids, so you can just look straight ahead. Just slight puffiness here, but what makes her look tired is the fact that her cheek has descended a little bit here. She has a trough here. She has some prominence here, which is thought to be orbicularis muscle, or the muscle that encircles the eye, or just soft tissue. It's hard to know. But we are going to lift the cheek through the lower lid and also up under the lip and also through a small incision here. And so we're going to elevate this area, including her cheek, and reposition it more superiorly in order to support her lower lid, to give her less rounding here. Also, she has somewhat prominent eyes, so we're going to give better support to the lower lid so it doesn't pull down. And also we're going to trim a little skin from the upper lid. Again, I like to take that up and out here. It ends in one line that goes superiorly as it goes laterally. And close your eyes, please, for a minute. And we want her to be able to easily close her eyes, but this will end up in a line that goes like this. And here the extra skin is about this much. And then we're also going to do a rhinoplasty. Kristen doesn't like this crevice in the middle of her nose, which is formed from a depression between the two cartilages that make up the tip. They're called the lower lateral cartilages. I've outlined them here. And you can see the face forms in vertical halves. It's normal to be asymmetric, and her left lower lateral cartilage is much larger than the right. It's stronger, it's very convex. The lower edge is right here, the upper edge is here. It can be felt by pushing on the lower edge and also visualizing the upper edge. And so I'm going to remove, actually, a portion of the lower lateral cartilage here will be removed. And I'm also going to take out a little rectangle here, maybe not that big, put a little stitch from here to here and here to here in order to decrease the convexity of her cartilage and make it a little narrower and more refined without altering this. We're also going to put a stitch between what are called the domes of the tip of her nose in order to get rid of the crease here. I've marked some landmarks here. This is the course of the frontal branch of the facial nerve that elevates the eyebrows. Elevate your eyebrows for me. And hopefully you shall be able to do that after surgery. Just kidding. And
I hope not.
No, I hope you can. And this is the incision we're going to go through to elevate this here. Will be hidden behind the hair. I'm going to just leave this here as a reminder to me, which is it's always above the field of the surgery, so we're not really in the vicinity of this in terms of surgical planes, but it does go through the field. Okay. So here we are with Kristen at 5 months post-op, and so how are you doing, Kristen?
Oh, I'm doing wonderful. Thank you, Dr. Schwartz.
Great. And are you happy with the results?
Oh, I'm very happy. I feel more confident. I look less tired, and nobody realizes I had surgery. They just think that, I look rested.
Great. Super. Great to hear. And it's been a pleasure treating you.